Peace and love, family. It's, Dr. Prince L here, and I really just wanted to jump on this live while the experience was still fresh in my mind. So a little while ago, I'm just getting out of an Uber and coming from my last patient of the day, while I'm in the Uber, somehow I got on my lab coat and I'm masked up and, I'm carrying my duffel bag full of, my equipment. And the driver says to me, hey, what do you do? And I explained to him, hey, I'm a doctor of acupuncture and oriental medicine. So like acupuncture, herbs, that's my bag. Like that's basically what's in my bag. And he goes, well, he starts telling me about the different things, the different endeavors he himself is in, and just how he is, one of the hats that he's currently wearing is as a home health aide or, a care provider, a caretaker of his own father who's been, who was diagnosed a couple of months back with stage 4 prostate cancer. And we got onto the topic of like the use of CBD, and it inspired me to really just get on my Instagram today and just make sure that I put this out there that regarding CBD, we don't want the CBD industry to become another example of the barbiturate opioid, high dose medication industries that have so many negative side effects, create addicts out of the patients who go to these pain management facilities, these oncology facilities to, that essentially create out of the patients, create pain, drug management, chemotherapeutic drugs, customers. All right. Now, I myself am, don't seek to create any kind of conflict between the Eastern and Western medical communities. If anything, I like to see myself as a bridge between the gap. I seek to complement or at least reduce the risk factors that could create more harm than they do good. All right. So, and it's actually from the abuse of certain medications by the patients themselves, because they're at the fault of the physicians that are prescribing those medications, that they become abusive in the use of those medications. So and it's also in that same capacity that I don't want the CBD industry to become another industry that essentially seeks to, generalize and create an umbrella or a tent of, of applicable uses for CBD, and, if a person is curious about using CBD, I want to publicly express right now that if a person seeks to use cannabis or CBD, whether it be topical or internal, I want to express that my mother's addiction issues when she had back surgery and the painkillers they gave it activated her addictive behavior. Yeah, that's absolutely correct. When patients, get surgeries for things that can actually be treated by lifestyle adjustments, this is one of the reasons why I feel that it's extremely important for me to express this, professional concern that I have for, my community, and my community is a very large community. Okay. It has nothing I'm talking about the human community. Let me just put it like that. The human community. All right. So when I'm asked the questions of do you think CBD will work for me? I perform an assessment based on the individual, right? Our healthcare systems in America need to become more individualized, need to take into consideration the individual's biology, the individual's metabolism, the individual's pre-existing medical conditions that may require the use of some substances, or may actually conflict and contradict and create more issues for the use of certain substances. So like, let me make it clear, right? When I'm asked, is CBD beneficial to me? I ask a couple of questions, and these are the questions that I ask. And for those of you who are watching this, this is not in any shape, form, or fashion the creation of a doctor-patient relationship. If you want a consultation to determine whether or not some of the things that I recommend may be right for you, or how to complement your primary care physician's treatment protocol, then definitely contact me through DM. If you've got my number, give me a text message. Let's schedule a 30-minute call. Let's see what we can make happen. However, when it comes to CBD, here are my questions. I begin with, do you have any difficulty with falling asleep or staying asleep because of your, medically diagnosed, Western medicine diagnosed issue, right? Yes, there's sleep disorders. Okay. Do you have any anxiety? Do you have any depression? Do you have any bipolarity? Do you have any schizophrenia? All right. Do you have any, does the person have any of the disorders that are related to the autism spectrum? Right. So that being said, and those questions either being responded to in the affirmative or in the negative will also determine whether or not I feel that CBD is applicable for patients. That's right. You hear the bell going off in the background. It's 12 o'clock on my side of the world. All right. And this is for whomever the bell tolls. If you're curious about how CBD can help you, then, definitely contact me. But we definitely don't want to start creating or, allowing the over excessive use of CBD to become something that becomes negative, that becomes stigmatized and seen as a new, pain management substance that people will be relying on to tend to the issues, their physical, mental, emotional, yes, maybe even spiritual disharmonies, diseases, disorders. Okay, so it just as a concerned medical professional and as a concerned human being who genuinely cares about the well-being and the quality of life of another human being, especially since we're all on this rock together, then the more people that see that an adjustment in what they eat, an adjustment in the level of physical activity, may be enough to prevent the abuse of substances, whether they're natural or synthetic. All right, because something that's not spoken about within the naturopathic community in the same way that it's spoken about in the allopathic community is the abuse of herbal supplements. Okay, so yes, a person can abuse a natural product. Yes, there can be negative side effects with the excessive use or abuse of a natural substance. All right, and so when it becomes clear that a natural herb is being abused, someone's got to do something. Someone's got to say something. If you see something, say something, right? So here it is that I see that, further down the line, and, maybe some of us will come back to this video and say, who was talking about this years ago? Dr. Prince L. Dr. L was talking about this. He was talking about how, the pharmaceutical industry in the future, and they're already on it because, competition within the pharmaceutical industry, it's not, Big Pharma doesn't like that. You know what I'm saying? Big Pharma does not like losing customers. Okay. And that's fine. I totally respect it because, naturopathic medicine should not like losing customers to allopathic, pharmaceutical prescribed drugs that may have, that have far greater side effects, cannot be consumed for long periods of time, actually create more issues than good, then I'm going to say yes. Like, I definitely, from a healthcare perspective, I feel that the naturopathic community needs to prepare itself and be prepared to compete against the allopathic community, for valid information, valid proof of whether or not the remedies prescribed and recommended by naturopathic, professionals, holistic healthcare providers would also say, like, hey, whoa, you know what? If you're going to talk about how, people are abusing our natural herbs, definitely make sure that, you make sure your own house is in order before you start talking about ours, okay? Because the allopathic house, the pharmaceutical house it looks like an opium den, okay? It looks like, patients coming in saying they got neck disorders, back pain, can't feel this, can't feel that, or feel too much of this, feel too much of that. By all means, if the allopathic community actually took the time to, truly not necessarily compete, nor should the naturopathic community really seek to compete against the allopathic community, but how there can be a collaborative effort to make sure that the patients stand at the forefront of the remedies and recommendations and prescriptions that are being made by us professionals, all right? Not being made by someone doing a Google search, saying, oh, I saw CBD would be great for this. Yeah, CBD might be great for that, but, things that might also be great for your issue might be a healthier diet, a healthier exercise regimen, more living foods, less synthetic processed foods, and by all means, if herd immunity is something to be considered, then we also have to consider that herd pain management is also a thing for us to be taking into internally, as food for thought. Okay. So, again, just to recap, my sentiment and my purpose for jumping on this live, the Uber driver who just brought me back from my last patient, as we discussed in transit, the benefit to using things like turmeric for pain management topically, or the use of celery because his father was diagnosed with stage 4 cancer, all right, prostate cancer. It would be likely to say that from a traditional Chinese medical perspective, the obstructed blood vessels leading to or from the prostate gland need to be cleansed. All right, like the obstructions need to be removed. If it's so bad, what Western medicine does is they use either radiation or surgery as their form of therapy. All right. On the holistic naturopathic side, we seek to improve blood circulation, remove the toxic substances that may be causing the obstruction, and allow the body to eliminate those substances in whatever form those substances can be eliminated, whether that be through sweat, through urination, or through defecation. All right. And when it comes to cancer, I highly recommend that each individual read the book by Arnold Ehret on rational fasting, and more specifically the chapter within that book that speaks on, which is Arnold Ehret's dissertation on constipation, which was probably one of the earliest recognitions and assessments of how cancer or, degenerative disorders, may arise when the body is unable to eliminate waste from the system. Okay. If a person is not able to eliminate fecal waste, biological waste byproducts, from cellular, from cellular synthesis or cellular activity, then, the things that could possibly arise could be anything that ranges from severe constipation, diverticulosis, diverticulitis, irritable bowel syndrome, gastritis, acid reflux, gingivitis, which is often considered a gum disease, but really has more to do with the gases escaping the esophageal sphincter, that leads to the stomach. If that sphincter doesn't close, then here it is that the alimentary canal, the digestive canal, is compromised in some way, and so gases or waste products are being eliminated in ways that the body normally would not eliminate them. Okay, so bad breath could definitely be more related to, some type of circulatory issue affecting the sphincters along the digestive canal. They're either doing their job too well or not well enough. All right, they're too tight, not allowing the matter to be released, or they're too loose, allowing everything to be released. Okay, and so of course, the digestive system is the sewer line, but before it is the sewer line, it's also the nutritive line. It's the support system that allows the body to continue to intake food substances, convert them into energy, and then allow it to be metabolized, processed, digested, and eliminated, okay, from out of the body. All right, like without that elimination factor, it's not your butt, it's your gut. Okay, and I don't mean that to say sound funny or to make light of a very serious situation, because I know I've had patients that have, that eat meals consistently, regularly, 3 to 5 times a day, but they don't poop. They haven't pooped in a week. Could you imagine that? Could you imagine eating something? Could you imagine eating so much that all of a sudden, your belly's getting bigger, but there's nothing coming out the back door, it's not being eliminated. These types of things, these types of these considerations need to be taken more seriously and need to be, presented to the public, because when we create a more informed public, then the public makes a better informed decision on what may be right for them. And it is always the responsibility of the patient to be fully informed, to ask the questions of how a treatment protocol may benefit them or possibly hurt them. All right, that is the medical patient's Bill of Rights. It's actually in the first one that the patient has to be informed. So, CBD is, as far as, the general population or any viewers that may be watching this live video right now, or, might share this video because they care about the well-being of a friend, a loved one, and whether that's by reposting this live, and yes, it will be going to an IGTV, or, passing my information along, or someone just like me who is passionate about this healthcare system, and not so much, vested or concerned with the healthcare industry. All right. So as a professional, I don't want to see any natural products being abused the same way a medical doctor, an allopathic doctor, doesn't want to see their patients become abusive or addicted to the synthetic pharmaceutical drugs that, again, carry far greater side effects, cannot be consumed for long-term periods of time, and may actually decrease a patient's quality of life. And as we all know, how our outlook, how we feel about our life, will greatly affect our health. Okay, so with that being said, I'm getting off my soapbox. I'm getting off my green chair, getting off my medical throne, and I'm about to go change out of these clothes so I can become a regular civilian again, and just enjoy my life and just pass along whatever information I can. So with peace, love, and the intent of assisting more people find natural alternatives to conventional medications, or other forms of therapy that may benefit them, please feel free to DM me, email me, get my number from someone. That's what I do. So peace and love. I appreciate you more for being on this video, and everybody else that's also been on this video too. I appreciate all of you, for being supportive to, the champion sound of natural medicine, okay? Champion sound, natural medicine, all right? Like let's continue to love on each other. Let's continue to show through our actions, our level of care for someone else that we may need to depend on in the future, right? Because no person is an island, right? And human, in one holy book that I tend to read like continuously or, routinely or when it's necessary, just always says, that the benefits that each of us enjoy we would not be able to enjoy without the bonds of society. All right. So we need a better society. And of course, like we can only better the society by bettering the individuals. And of course, bettering the individuals means giving them more information for them to just think about it. All right. So I'm out. Peace and love. Islam. Shalom. Happy Yom Kippur. Whatever. Just have a great freaking day, man. One man. Love your life. All right. Like you've been loved and how you were created in the nature of love. Peace.